Thank you, Mr. Chairman. President Trump and the Republicans have said they are going to repeal the Affordable Care Act within weeks. But so far, President Trump has not produced any plan for helping millions of Americans who will lose their coverage the day the repeal goes into effect. The president also has no plans for the rules that will affect everyone else with insurance, like questions about pre-existing conditions and lifetime caps and that sort of thing. So a lot of people in Massachusetts are stuck in limbo, and they are really worried about what happens next. Will they lose coverage for mom's cancer treatment? Will they still be covered for their child's asthma medication? Will a nearby hospital or community health center be able to survive and still offer services? So on his first day in office, President Trump signed an executive order telling federal agencies, and I want to quote here, to waive, defer, grant exemptions from, or delay implementation of parts of the Affordable Care Act. Ms. Tavenner, your organization represents health insurance companies. Has the president or his administration specified what waivers the federal government will issue to carry out this executive order?
Senator Warren, he has not.
He has not. Has the president or his administration said what exemptions will be granted?
He has not.
Has the president or his administration listed what parts of the Affordable Care Act would be deferred under his executive order?
We do not have any details on the executive order,
So he has not.
Right.
So, Ms. Tavenner, if so much of what this order means is unknown, do your members face significant challenges in pricing health insurance through the exchanges or through private markets?
I think this is part of what I've tried to stress in this hearing. We need predictability, and we need predictability for long periods of time in order to price and price effectively.
Okay.
Consumers win in that environment.
So last week, the president did take one action that everyone could understand. He shut down millions of dollars already budgeted to help people sign up for health care. Now, Ms. Tavenner, if fewer people signed up for coverage last week in the open enrollment period, does that help or hurt the stability of the individual market?
Senator Warren, we released a statement the day that announcement was made encouraging we need full and robust enrollment periods.
So any attempt to undermine the enrollment?
Well, if you assume that the risk pool is a young and healthy risk pool, and young people act like my children, they wait till the last minute to sign up for everything, okay? So we want to keep enrollment open and robust.
Okay, so I take that as it hurts the stability of the individual market and is particularly acute because of the timing on it. Governor Beshear, you know more probably than anyone what's actually at stake in these debates because you set up an individual mandate in your state and you expanded coverage for millions of people in Kentucky. What does it mean to the families in Kentucky to be able to get affordable care through the ACA?
Senator, as I mentioned, we're one of the least healthiest states in the country. And there was no way we were ever going to really change that. We could peck around the edges, but we didn't have the resources to do that. And then along came the ACA. And it gave us the most powerful tool in our lifetimes to finally get everybody in our state healthy. And that's what the bottom line is. I don't care what you call it. You know, I don't care what party did it. It's getting all of our people healthy because a healthy people, not only is their quality of life better, but our workforce will be more productive, and we'll create a lot more jobs because of it.
Thank you, Governor. You know, the official topic for today's hearing is Obamacare emergency, and I have to say, I couldn't agree more. President Trump is creating chaos and sabotage and his own special baked-up emergency here. Insurance companies can't figure out what's going on. Families can't figure it out. The only part that's clear is that he's trying to undermine the Affordable Care Act by getting fewer people to sign up. This is an emergency, and I sincerely hope that the politicians who are creating this emergency will come to their senses before millions of Americans are hurt. Thank you, Mr. Chairman.